Hey everyone! Thanks for joining me for another episode of Heatlhzone with Gilbert Cheah. I'm Gilbert Cheah. I'm the editor of Heatlhzone Singapore, a Facebook page dedicated to covering health and wellness issues specifically for a Singapore and regional perspective. So far in this show, over all the many weeks, we've covered different health topics and reported on developments from the point of view of Western medicine. But of course, there's a whole other world aside from Western medicine that has been around for thousands of years, and that is traditional Chinese medicine, or TCM. Now, TCM is a huge field covering many different disciplines, from herbal medicine to acupuncture and cupping and more. There's been a lot of mystery, misinformation, and myths about TCM, and even controversy, as there have been cases of some people dying after taking herbal medicines and it hit the headlines. But of course, people also die after taking Western medicines, and no one thinks that discredits all of Western medicine. The problem is that many people find it easy to fear and misconstrue TCM because it's foreign and unknown to them. But that is just intellectual dishonesty and laziness. But over the years, the Western world and Western medicine have studied TCM, and there's been a lot more acceptance, understanding, and respect for the field of Chinese medicine. In Singapore, the field of TCM, like that of Western medicine, is strictly regulated. There is a Traditional Chinese Medicine Practitioners Board, TCMPB, which is a stat board under the charge of the Ministry of Health. It was first established in 2001 under the Traditional Chinese Medicine Practitioners Act of 2000, and it registers TCM practitioners, both acupuncturists and TCM physicians. It accredits TCM institutions and TCM courses for the purpose of registration, and also regulates the professional ethics and conduct of registered TCM practitioners. So with such oversight and control, Singaporeans can rest assured that when they go to a licensed TCM practitioner here, they will be seeing someone in a practice that has met uniform standards of safety, training, knowledge, and ethics. So this week, I want to shed some light on the world of TCM and specifically focus on one major component, namely acupuncture, and help clear away some of the misinformation and myths. Now, as most people know, acupuncture is the practice of inserting thin metal needles into the surface of the skin and then manipulating these needles by twirling and moving them. And sometimes electrical stimulation is also applied through these needles. But what's the purpose of this? Does it work? According to TCM practitioners, the human body has more than 2,000 acupuncture points connected by pathways or meridians, and the body's energy or qi flows through these pathways. Blockages or disruptions of this energy flow can cause illness. By inserting acupuncture needles into certain points, it's believed to improve the flow of qi, thereby improving health. But how does Western medicine interpret this belief and philosophy? And is there any scientific proof that acupuncture works? Well, surprisingly, the answer is yes. Multiple studies on acupuncture by Western medicine have revealed many interesting things. One was the discovery that acupuncture points on the body are also places where there is a lower level of electrical resistance on the skin. You see, our skin has a natural resistance to electricity, and at certain points, the skin's resistance level drops. This means that electrical currents can more easily enter the body through these points of decreased electrical resistance. And interestingly, these points of decreased electrical resistance on the skin coincide with acupuncture points. If you take an ohm meter, which measures electrical resistance, and you run it over your skin, you will see fluctuations in the levels. When acupuncture needles are placed on the skin at these points and manipulated, it sends electrical currents into the body, and this has many different effects, such as increased blood flow and higher production of pain-killing hormones such as endorphins and serotonin. But if you place acupuncture needles on the parts of the body that are not acupuncture points, you do not see the same physiological reactions. Now, there have been many studies and experiments conducted by top Western scientists on acupuncture that showed some fascinating results. In one notable study done at Boston University School of Medicine, which is my alma mater, neurologists tested subjects with real and fake acupuncture to see if there was any difference in reaction. What they did was to treat stroke patients who had suffered paralysis on one side of the body, and they gave them either 20 real acupuncture treatments or 20 fake treatments. Some patients received acupuncture needles at the acupuncture points, and others had needles at non-acupuncture points. And at the end of the study, they found that the patients who received the real acupuncture treatments had significantly better response and movement, while the patients who received the fake treatments had no response at all. What they saw was increased blood flow to the damaged areas of the brain when there was real acupuncture done, but no increase in blood flow when the needles were not in the acupuncture points. This increase in fresh blood flow helped the damaged areas of the brain to heal better. Fascinating. Since then, there have been numerous other studies that have confirmed this finding. And now using acupuncture to help in the recovery of stroke patients is widely practiced in both Chinese as well as Western medicine. It is believed that sending electrical impulses into acupuncture points stimulates the central nervous system, and this releases beneficial hormones, neurotransmitters, and other chemicals into the muscles, the spinal cord, and the brain. These biochemical changes help stimulate the body's natural healing abilities and also promotes physical and emotional well-being. Now, studies by the US National Institutes of Health have shown that acupuncture is an effective treatment either by itself or in combination with conventional Western therapies to treat many conditions, including acute pain after surgery, for example, and also chronic pain conditions such as osteoarthritis, tennis elbow, fibromyalgia, myofascial pain, back pain, carpal tunnel syndrome, headaches, menstrual cramps, and asthma. And aside from pain management, acupuncture is also recognized by the World Health Organization as being useful in treating both high and low blood pressure. It's also good for treating nausea caused by certain medical procedures such as chemotherapy. And it is also a preferred way of treating a facial paralysis condition known as Bell's palsy, where one side of the face droops after a viral infection. Bell's palsy usually goes away by itself after some months, but acupuncture has been found to help patients recover much faster. Another use of acupuncture that is increasing is in treating alcohol and drug addiction. Researchers have found that people undergoing acupuncture treatments experience more feelings of calmness and relief from withdrawal symptoms. They have less craving for drugs and alcohol and can overcome their addictions better. Now, it's not entirely understood how acupuncture does this, but researchers believe that one reason is that acupuncture raises the levels of endorphins in the body's nervous system. And endorphins are a powerful pain-killing natural hormone that also gives what is called a runner's high. And this helps addicts with their cravings and withdrawal. Now, although acupuncture is very widely practiced, many people who have not had it are unsure what to expect from the treatment. So here's what you can expect if you're trying it for the first time. Thin, flexible needles will be used, and these are always disposable single-use instruments. Don't let the idea of needles scare you, as acupuncture needles are not like the hollow needles that are used for injections. They are not hollow, and so they can be very thin. They're actually not much thicker than a strand of human hair, and they can go between skin tissues, making them less painful. Most people report feeling minimal pain as the needle is inserted. There's usually less discomfort on areas where your skin and muscles are thicker, such as on your belly and back. Areas with thinner skin and much less fat and muscle, such as the neck, hands, and feet, might be more sensitive. But acupuncture is not meant to be painful, so if you do feel pain, tell your acupuncturist. They can adjust the needles or choose other points that will be more comfortable. The goal of acupuncture is to lessen pain, not cause it. So do not have a no pain, no gain mindset here. For more severe causes of pain, the acupuncture may use Electro acupuncture, which involves application of a low-level pulsating electrical current between two needles. And this will help penetrate the skin deeper and help with better healing and greater pain reduction. Now, during the treatment, you most likely be lying face down, face up, or on your side, depending on where the needles are going to be placed. Alternatively, the acupuncturist may ask you to sit in a chair. A typical acupuncture session is around 30 minutes, depending on your treatment. But the needles are usually in for only about 10 to 20 minutes while you relax. So the entire session usually doesn't take long. The first session will take longer because they have to try different things with you. And most people feel either relaxed or energized when the needles are inserted, and they usually say they feel better after the session. And the number of treatments you will need will, of course, depend on your body's condition and the body's response to the treatment. Someone with a chronic condition may need 1 or 2 treatments a week over several months. An acute problem normally improves after 8 to 12 sessions. Now, although acupuncture is perfectly safe for the majority of people, there are a few groups that should check with their doctor first before undergoing acupuncture. And these include pregnant women, people with pacemakers installed in their hearts, and anyone with a bleeding disorder such as hemophilia. Similarly, if you are on blood-thinning medication, be sure to check with your doctor first. For everyone else, acupuncture can be a very effective way to help your body heal with many different health conditions. It's non-invasive, there are no drugs involved, and the results have proven to be really remarkable, thanks to the thousands of years history of Chinese traditional medicine. So that's it for this week's episode of Health Zone with Gilbert Cheah. I hope you found this helpful. In the weeks ahead, we'll be exploring other facets of traditional Chinese medicine and be bringing you more of the best ways to stay healthy and to be well. So thanks for joining us, and we'll see you in another episode. In the meantime, please stay safe and be well.